So here we go with EF2 utilization part 3. If you haven't yet looked at parts 1 and 2, please do so before listening to this so everything will make more sense to you. Thanks so much. Enjoy. So let's talk about EF2 salary compensation. I get phone calls sometimes from dentists saying, what's the going rate for an EF2? And that kind of irritates me because what's the going rate for a dentist? Well, some dentists have $1 million practice, some people have multi-million-dollar practices, some people have $500,000 practices. It depends on what they're putting out, the quality of what they're doing, how well they advertise, so on and so forth. So in 2015, EF2 had been legal for 5 years, and so we thought we had enough people out there. It started out slowly, like any new thing in dentistry does, because dentists tend to kind of hold back for a while. At the time, we had probably between 600 and 700 EF2s out there, so we did get a survey out through SurveyMonkey, got lots of results, and we asked a lot of questions, not just salary compensation, but what were they doing? What procedures were they most doing? How often? What kind of practice were they in? Where did they go to school? What area of the state were they working in? And so on and so forth. So got a lot of information out of that. But the primary portion here that we're going to talk about is the compensation. So back in 2015, of the people who responded to our survey, 39% said that they were earning $250 a day. 38% said they were earning $350 a day, 16% were earning $450 a day, and 7% were earning $650 or more a day. We went back, looked carefully, averaged all those out, and came up with a $316.36 per day average. But please note that 61% of the folks who responded to that survey earned considerably more than that. So we're looking at just under $40 an hour initially on average at that time. We went back a couple of years later and did the same survey, but we didn't ask a lot of the other questions. This was basically based on salary compensation. In addition to these fees, this is their hourly actual pay. In addition, most people were also provided some various forms of additional compensation in the form of perhaps medical insurance or leave or vacations or whatever. So by 2018, salaries had gone up a bit. If you look at the percentages, so let me go back to the previous slide. There was 39% for 250 and 38% for 350. Now we're 29% at 250, 35% at 350. Our number here for 450 or more has gone up to 27%, and our 650 or more has gone up to 9%. In regard to the 250, we were able to do an analysis in both times, and it turned out the majority of the people that were kind of in the 250 to 275 range per day primarily worked in primary care clinics and rural Indian health clinics where the fee per patient is much lower. But those folks are also provided significant benefits, far greater than and higher levels than most private offices would be giving. All right, so how about state exam results on various programs? When we first started out, J Productions Dental Seminars, which is the corporation that I sit on the board for, and I'm the CEO for, and UOP Dental School were the two programs in Northern California. And there was UCLA and EFTA in Southern California. So that was for a few years, just us. And then other programs began to be added, and now I think there's about 10 or so programs that are approved by the dental board. The dental board has minimum standards that you must meet in order to become approved as an EF2 provider. Many of us, or some of us I should say, go way beyond those minimum standards, and J Productions is well known for doing that and having extremely high pass rates on the state exams, but also putting out a very, very high quality practitioner. So it's not just about exam results, but exam results are somewhat reflective of the quality of education the person is getting. So prior to 2015, instead of listing individual programs in the dental board results and packets and in dental board meetings, they simply did the pass rates from Northern and Southern California. And it was J Productions that pushed really, really hard for them to start publishing individual programs, because we felt that consumers of education have the right to know the quality of education they can expect to get from various providers. So here we are. So even though we don't have results prior to 2015, we routinely had 96 to 100% pass rates on the exams for years. So here we are in 2015. Again, just the two schools listing here, or a couple of schools listing here. So we have J Productions Dental Seminars for amalgam composite. There's two parts to the exam. Amalgam composite, we got 98% pass, and cord retraction and final impression 100% pass. UOP, taking the exact same exam on the same day in the same place with us, did 12% pass on their amalgam composite and only 50% pass on the cord. Now, I must say that UOP has done a tremendous job in improving their pass rates and improving their program over the last couple of years. So we're glad to see that, because we want everyone that's getting an education to get a really good one and to put out a really good practitioner, because it's reflective of the profession. Okay, then we go to 2016. Again, 100% for J Productions, 90 and 67% for UOP. That time, EFTA results were here, 83% for both of the procedures there. Down here we have the state averages. Fourth stuff, the 90% is because of UOP's 90 and us 100% that kind of helped out. Even though I'm not listing all the other programs, the results here are based on all the programs that participate in exams. 2017, same thing. We're up there, 90, 94% and 100, and so on and so forth. So you can just kind of take a peek at what's going on here. 2018, a couple more schools were added. Loma Linda came online. Loma Linda University in Southern California came online and did a very good job with their amalgam composite straight out of the shot for the first exam. Not so great on the cord and impression, but that can be tricky sometime with live patients as well. So you can kind of take a peek. We don't have all the programs listed. There's a couple fairly new programs that have come online. One in the Bay Area that did not do particularly well on their first exam, but we don't have that listed here. And then I didn't list everything for 2020, and then, 2019, and then of course 2020, a lot of the exams were suspended because of the COVID virus and everything happening, so we don't have any results yet for the 2020 stuff. But just good stuff to know. So let's talk a little bit about the education, if you're interested in becoming EF2, or if you're interested in having an EF2, what's required. To become an EF2, you have to have proof of current active license as an RDA, and certification in Pitt and Fisher sealants, and or be an EF1. The difference between EF1 and 2 is you can no longer become an EF1. EF1 were just a few duties that have been around for over 30 years. There's really not truly an EF2 because all the duties were added to the F category, but EF1 and 2 gives the dentist the option to know what the person can legally do. If someone has gone to school since January 1st of 2010, they are automatically an EF2. In our course, all EF1 and EF2 duties are included in the program. If someone comes into the course as an EF1 already, they don't have to repeat the things they're already licensed to do. Current CPR certification, which of course in order to be a currently licensed RDA or EF1 you have to have that anyway. For us, so willing to work very hard and give up 15 weekends to get your new license. You do have to complete crown preparations on 5 patients, have them temporized and bring them to class. We remove the temporary, give anesthesia for you, have you remove the temporary, clean it up, and do cord retraction, final impression in class. 2 patients for a patient assessment, which can be anyone over the age of 18, and the ability to complete 20 restorations in your office once you're released to do so. So in our particular program, roughly 3 to 4 months into the program, you would be released to do those restorations, and we would start you with class 1 and 5 restorations, and then eventually go to class 3s and then class 2s, and eventually allow you to do cord retraction and final impression with a contractual agreement with the office, sort of like an externship, so that you could do those procedures. And that's kind of how that works. Some of the other programs do that in a slightly different way, but that's how we happen to do it. For J Productions Dental Seminars, all the lectures and examinations are online. You're given about 4 lectures per month and exams to do. We have developed all of our own lecture materials and all of our own procedure videos. We've been asked by many other programs if they could purchase them, but we keep them for us because it's how we do the procedures. You come to our facility 2 weekends per month for the 8-month time period, so that comes up with actually more than the required number of hours that the board requires. And we have our clinical facility in a working dental facility. Now, I mentioned that I taught for dental health courses in hygiene and assisting for many years at Sacramento City College as a professor there. And I worked in that kind of environment, and I really, because you have to be a dental professional already in order to come into an EF2 program, you're used to working in a clinical area. I wanted to do something really nice, and so we lease a dental office, a beautiful dental office in Auburn that has 18 operatories and a beautiful lounge area for the patients and a reception area when we have patients. It's as if they're walking right into a regular dental office, because that's what it is. So UOP's dental school has theirs at UOP Dental School. The FADE has a beautiful classroom type facility for theirs. A couple of the other programs run out of dental offices or other clinical situations, but this is how we do our stuff. Well, as supposedly Plato once said, necessity is the mother of invention. And I'm very proud to say that we probably will have the safest EF2 program in regard to aerosol particles, of particular concern with COVID or any other respiratory disease in the state for some time, because the facility that we use has invented a device that pulls about 98% of aerosols away. It's absolutely amazing. So you kind of see it here when we're working on patients. That'll be happening. So here I am with it on either side of my face here, but we're very proud that we have that added protection for our students, our faculty, and our patients. Last thing I want to mention here is that it's mutual. It's a team. Everybody in your office is important and hopefully equally respected for what they do for your practice. Hope you enjoyed my presentation. Hope that you got some things answered that you wanted to know. Yippee skippy.